gentlemen, my name is Sandi Srinivasan, and I'm very proud to represent the close to 50,000 alumni of the IIT across the US. I'd like you to think about one thing, that every single one of us, whether we are on the board or was a volunteer for the summit, it's over about 150 of them, all do this work after their day jobs and on weekends. We are IIT, so let me share some numbers with you. You probably heard some of the conference numbers from Sanjeev, but just as a repeat, we've got for your feast over the next 2 days, over 275 speakers. Over 400 startups are being provided this platform under Sanjeev's leadership to showcase at no charge to them. This is truly fostering the entrepreneurship that he was talking about. Not to mention that we have provided a mega summit that's being provided free of charge for close to 15,000 attendees. But the Pan IIT USA is actually much more than that. In line with the vision articulated so well by Narendra Modi ji a short while ago, what we are truly about is thrusting India in a positive way into mainstream America, or mainstream of any country where we live and work. And this is truly the bigger India part and the contributions that Indians make to the mainstream communities. Again, I'm using possibly some of the words by Modi ji. We're all about being good ambassadors to the countries where we live and work. On that note, I definitely will be remiss if I didn't give a shout out to the other Pan IIT organizations who have worked closely with us for this summit across the globe, from the near 25 countries that are represented here today among the attendees. Let me just pick America as an example because it's Pan IIT USA and I'm familiar with it. Some of you may be aware, but for those that are not, in terms of contribution to the community, we enjoy the fact that we are the only foreign institution, the contribution of whose alumni has actually been recognized by the United States Congress. They say Google is a good check to potentially fake news, which is the term. So I give you the Congressional Resolution 227. I often say with a tinge of humor, that even this congressional resolution pales into insignificance. You know that you've really made it, especially in America, when you appear not once, not twice, not thrice, but at least 6 times on Dilbert, the Scott Adams cartoon. We've truly come a long way in the last 20 years since our founding around the early 2000s under the guidance of Rajat Gupta and a few very senior stalwarts from the IIT. Our vision at the Pan IIT is to take this contribution to the planet. Again, I'm stealing Modi ji's words here again, to the next level. And to borrow from what Sanjeev said earlier, to truly make an impact on 1 billion lives in every which way. The future, ladies and gentlemen, is indeed now. This might sound strategically nice, so I thought I would give you some specific examples. As a result of this summit alone, we have established extremely deep relationships with all the components of the startup ecosystem. We plan as our vision going forward to take this forward with continued relationships and foster the new companies of the future. This is exactly in line with Modi ji's message of encouraging the startup culture. Another example is part of our vision is to help shape education in terms of the mentoring and the younger generation that Modi ji was pointing out, in the form of creating significant scholarships for students. Just envision that there is a Pan IIT USA scholarship that is available to students based on pure merit. It is an extremely tough scholarship to get, but by golly, if you get it, it's going to be phenomenal. We've made some tremendous strategic partnerships with some great companies who've been our sponsors at this conference, with whom we'll pursue these opportunities. This is again exactly in line with Modi ji's powerful message of ensuring that we foster the younger generation of our planet. You know, I was particularly touched with Modi's passionate but very simple statement. Don't forget, you are all sons and daughters of India. He followed this with an equally emphatic message of saying, I know you guys do well in giving back to the alma mater, but you guys need to do better at giving back to India at large. I kind of took his words to heart, you know. So I do want to mention and recognize that we do indeed have a great offshoot organization that was an offshoot of the Pan IIT, an organization called Wheels Global, which under the leadership of Suresh Shenoy and Ambassador Pradeep Kapoor, that both of whom are doing excellent work, especially in the area of rural development. And Wheels, by the way, is also supporting the summit. But that would make me get away easy. I have to be honest. This is definitely an area where the Pan IIT USA can look to improve. My takeaway already from just the start of the summit is that this is an area where we can look at possibly adjusting our mission going forward. So thank you again, Modi ji, for this great reshaping of my thought process. To use your words again, Modi ji, we will reform, we will transform, and we will perform. To all the attendees, I thank you for being part of today and tomorrow's events. I want to reach out to all of you. I encourage all of you to continue to engage with the Pan IIT USA after this conference, whether it be as a volunteer, as a strategic corporate partner, as a generous contributor of funds, or in any which way. My only personal guarantee to you is that whatever you give us, we will multiply that input quantum fold in terms of impact to the communities where we live. Enough said about the Pan IIT USA. I now have the great pleasure, the extreme privilege of handing the podium to Ron Gupta. Ron Gupta is not only my great friend, he's a fellow member of the Pan IIT USA board. Interestingly enough, he's an architect by profession, but more importantly, he is the architect for this incredible program that you're going to see over the next 2 days. So ladies and gentlemen, give it up for my good friend, Ron Gupta. And Ron, take it away, man.
Thank you. Thank you, Viri. Thank you, Sandy, and thank you, Sanjeev. Good morning, good afternoon, good evening, depending on where you're at. Welcome to IIT 2020. Back in March, when we got hit with COVID-19, or when COVID-19 became publicly known, we thought this is just temporary and it'll go away. We'll be back to the norm. Unfortunately, we realized that it's going to take time and it's a new norm we're going to go through. Pan IIT used to do a lot of physical conferences from time to time here in the US and in India. So we realized back in July that we have to, in this age of COVID-19, continue our interface with our alumni and create these conferences online so that we can reach out not just to the people who are physically able to get to a conference, but also the audiences worldwide. We have a phenomenal program lined up for you, and I'd like to talk with you a little bit about what to expect and which particular session to go to. We have several exciting keynote speakers. In fact, just after this talk, you'll see Dr. Vivek Murthy. In fact, when I woke up this morning, I saw the Washington Post, and there was an article that Vivek Murthy is America's doctor now. He's been appointed as the head of the COVID efforts in the Biden-Harris transition team. So we're honored that we'll have Vivek Murthy in just a few minutes. We also have Arvind Krishan, an IITian, CEO of IBM, will be speaking shortly. And also President and CEO of FedEx, Raj Subramaniam, he'll be speaking as well. We have a number of superb panels today on different topics. COVID-19 has impacted the global economy significantly. It has turned the education system or methodology of delivering education upside down. So we'll talk about education in the public sector as well as in the private sector. And we'll talk about technology intensification, innovation. How come innovation is really the main way to go forward? We'll have a keynote speaker from Zoom. Did we ever realize that Zoom will become so popular in just a few months? So from Zoom, we have their CEO, Aparna Bawa, who will give us a keynote talk. Then later on, we have 3 other panels, one on technology as a business, where the CTOs of some of the largest companies in the world will talk about how technology is no more just a tool. It's now become a business. Technology itself is a business. We'll have another panel, another one on education, this time talking about the private sector, how many private sector colleges are being opened in India with quality and accessibility as the key motives. Philanthropy is important. It's very, very important for all of us, whether we are IITians or not IITians, that we engage with our institutions, our alma maters, and India as a whole. As the Prime Minister himself told us, that we are the sons and daughters of India. So we'll talk about philanthropy and some of the key philanthropists who have connection with the IITs. And today at the end, we'll have another keynote by Ajay Gopal on simulation. When during COVID-19, we are not able to experiment many of the things in real, we are able to simulate, and the power of simulation is going to be discussed. Briefly tomorrow, we're going to have a number of keynote speeches, starting with Minister of Commerce and Railways from India, Piyush Goyalji, followed briefly by a talk by Kevin Rudd, who is a former Prime Minister of Australia and also the President of Asia Policy Institute. We have a panel from one of our biggest sponsors, NTT-BC, where they'll discuss digital transformation and data. And we'll have a superstar in the startup industry, Jyoti Bansal, and he will speak as a keynote speaker. Then we have several panels tomorrow after that. One on healthcare, taking from what Dr. Murthy says today onto healthcare. What is the technology aspect of healthcare? And most exciting, we're going to have a discussion on space exploration. There are Indo-US joint programs being done between ISRO and NASA on radar. And General James from JPL and NASA is going to start that discussion, followed by a phenomenal IITian, Bob Balram, who has designed a helicopter that's on its way already to Mars, and he landed there in April of 2021. And
no way.
Yes, and fly over Mars, taking pictures, collecting samples, and so on. Very exciting panel. Then we have a directors forum where 8 of the IIT directors will get together and speak about IIT's role in education in India. We'll also have other keynotes tomorrow. Nikesh Arora, who's into networking, and also Desh Deshpande, a phenomenal IITian, followed by 3 other panels. One on quantum computing, the second quantum revolution, and a panel on food. As Sanjeev talked about earlier, what are the innovations in food? Supply of food and distribution of food is going to be critical for the growing population of this planet. And finally, we'll have a closing address by a phenomenal lady, an IITian from Australia, all the way from Australia, Veena Sahajwala. And she'll speak about green steel, how to recycle just about everything into something productive. So we have a very, very exciting program for you, and we encourage you to join the panels or the keynote speeches that you would like to. Thank you as far as the program discussion is concerned. At this time, it's my great honor and personal honor, I should say, to introduce our next keynote speaker. It's none other than Dr. Vivek Murthy. Dr. Murthy, as I said earlier, is now called America's doctor. He is going to handle the COVID-19 situation. He was the Surgeon General of the United States for a little over 2 years, and he has launched various programs for humanity to deal with the opioid crisis, to deal with the chronic stress and fear that people develop, particularly during a pandemic like COVID. He is a graduate of Palmetto High in Miami, Harvard University, and then MD and MBA from the Yale University. Ladies and gentlemen, it's my great honor to first introduce Dr. Murthy, but also introduce Dr. Sanjeev Arora, who's going to have a fireside chat with Dr. Murthy. Dr. Sanjeev Arora is head of a program called ECHO, E-C-H-O, stands for Extension for Community Healthcare Outcomes. He is a professor at University of New Mexico. Now, Dr. Murthy called us 2 days ago saying that he wants to speak with the IIT. But what he's afraid is, in these 2 days, he could be called in any second to a Biden-Harris meeting. And he did not want to miss speaking to us. So he called us for a fireside chat so that he could talk to us and talk about COVID-19. He is a very, very humble individual. So ladies and gentlemen, I present to you a fireside chat of Dr. Vivek Murthy by Dr. Sanjeev Arora. Thank you.
Welcome, Dr. Murthy. It's such an honor to have a chance to meet you and to have a chance to spend some time with you. First and foremost, congratulations on being appointed the co-chair of the COVID-19 task force for the United States. We know from your past experience that the country is safe in your hands, and I look forward to your leadership in creating a safe environment for all of us in the United States. I'm going to start with my first question by asking you for your vision for how the United States will be responding to this COVID-19 pandemic over the next many months, and what would be your key priorities?
Well, thank you so much, Sanjeev, for that kind introduction. And it's so good to be here with you and all of those who are listening from around the world. I only wish we could have been together in person for this conversation. But, to start with, on COVID, obviously we are in the middle of a terrible global pandemic. We haven't seen anything like this in well over a century in the world. And it continues to take a terrible toll on not just the United States, but on countries around the world. So the situation is urgent. And what I anticipate you will see with the new administration, with President Biden and the team that he brings in, is a real focus on a few key areas. One is, first and foremost, stopping the spread which is occurring rapidly right now. You'll also see a focus on reopening safely, recognizing that we have to reopen schools, we have to reopen the economy, we have to allow people to get back to seeing family and friends, but we need to be able to help people figure out how to do that safely, give them the tools, and in some cases give institutions like schools and workplaces the tools to operate more safely. The third area you'll see a focus on is protecting the vulnerable. There are populations that have been hard hit by COVID-19. The elderly, among them, we know that the chances of hospitalization and death are significantly greater if you are over the age of 65. But we also know that the United States in particular, that racial and ethnic minorities have been hard hit by this virus. And so a focus on making sure that we deliver precautions and resources to those hardest hit communities is going to be essential. We have to do those three key things: stopping the spread, reopening safely, protecting the hardest hit, while strengthening our health system and while rebuilding public trust. And it's worth saying here that, we had challenges in our health system in the United States long before COVID showed up. We had made progress in covering people, but we still had millions more who did not have coverage. Drug prices were far too high for many people to afford, and the public health infrastructure was not as strong as it could have been. But we have an opportunity now to address some of these holes, not just for COVID, but for the next pandemic and for the challenges we face in between pandemics. But none of this is going to be possible if we don't find a way to rebuild public trust during this process. People's trust has been damaged, particularly in the United States, but in other countries as well, where they've questioned the leadership, they've questioned science, they've wondered who they can trust when it comes to getting through this pandemic. And part of rebuilding public trust is communicating honestly and openly. Part of it is leading with science and with scientists and putting experts forward to speak directly to the public. And part of it's about delivering on results. So I think you'll see a real focus on these key areas once President Biden, takes office on January 20th. And you can already see that he and his team are laying the groundwork for doing that even during this transition.
Well, thank you, Vivek. Most of us know you as the previous Surgeon General, but in your role as the Vice Admiral of the U.S. Public Health Service, you had 6,600 public health officials. There was a lot of international work going on too. It wasn't just the U.S. But also, when I look at your background, you have been interested in public service all your life. You founded a not-for-profit organization called Swasth in India. I think the question for you is, we know in the United States, anyone who wants to get vaccinated would probably get vaccinated in 7 months or so, 8 months maybe. But what about the rest of the world? How are you thinking of what should be the role of developed nations in assisting some of these other countries? Of course, this audience is specifically interested in India, as I am, but also, at least in my project ECHO, we work in 165 countries, and I'm saying, wow, how will they deal with this? How do you see this evolving?
Well, it's a really good question, Sanjeev. And I think one of the things that we learned when I was Surgeon General, about Ebola and from the Zika experience was that was something actually, frankly, we've known for a long time, but we keep realizing during each of these outbreaks, which is that we are deeply interconnected as a world, and you can't just close off your borders and assume that you can keep your people safe. We've seen that during COVID-19, where this virus has spread from country to country, and very few places have been spared, whether they've had economic resources or not. Once you recognize that, then the inevitable conclusion is that if we truly want to be safer, we've got to work together. We've got to recognize that our destinies are intertwined, and that means we have to not just cooperate, but we have to invest in each other, because investing in each other is in fact investing in ourselves. Part of how do we do this? Well, part of, I think, what we have to do is we've got to be building relationships with each other during peacetime, not just waiting for a crisis. Those relationships have to be marked by a spirit of collaboration and by bringing material resources to the table to work together. The other thing that we've got to do, though, is we have to work together in particular to build stronger public health systems. We know that where public health systems are weak, our ability to identify outbreaks and to contain them is limited. Part of what we saw during Ebola was that the virus was spreading quickly in countries that had infrastructures that weren't quite able to identify and contain the virus quickly enough. And as a result, it spread to many other countries, including a few cases that came to the United States. But what we also have to do is to work with each other to build a global rapid response infrastructure so that we can efficiently identify where concerns arise in terms of a new virus or other pathogen, and where we then rapidly bring our resources together to investigate, to address and contain that new pathogen. If we do that, then we can be safer, and we can be safer together. But it's going to involve not just a spirit of collaboration and not just putting our material resources, at the table, but it's also going to require, I think, building a culture of innovation globally, where we support one another in developing better technology and developing better public health, systems and infrastructure, so that we can ultimately serve our populations better, recognizing that when each of our populations and countries across the world are healthier, then we all actually do better, because it's a less likely environment where disease can spread, and ultimately that will affect the whole world, as we're seeing with COVID-19.
Thank you, Vivek. I think one of the challenges that many professions are facing right now is loneliness, anxiety, stress. There's a tremendous amount, as you know, suicide rates are higher. Healthcare workers have tremendous fear that they'll get the virus, fear that they'll get it and take it to their elderly parents. And there is a tremendous amount of anxiety. It so happens you've written a New York Times bestseller before COVID-19 on the healing power of human connection in a sometimes lonely world. This has become a lonely world. At least for me, it's become a lonely world. And what insights did you gain when you were researching and writing that book that are applicable to the thousands of learners on this network today listening to you?
Well, Sanjeev, it's interesting, because if you had asked me 5 years ago if we would be talking about the subject of loneliness and social connection today on this, at this conference, I would have said you're mistaken. It's unlikely. But what happened is I came to realize through my work, not just as Surgeon General, but through my work in the hospital, caring for patients, that the issue of loneliness is really a profound and common challenge. And it goes under the radar because we don't talk about it very often. We often feel a sense of shame if we feel alone. We feel that being lonely is equated with being a loser. And it means that something's wrong with us. But if you actually dig into the research around loneliness, if you understand what's happening to us at a biological as well as psychological level, what you quickly realize is that nothing could be further from the truth. And that, number one, loneliness is exceedingly common, especially now, with double-digit percentages of the population struggling with feelings of being alone. And this is not just people who live alone or people who perhaps live in isolated regions of the world. These are people who live in densely populated areas, who have large families and dense dense neighborhoods. These are CEOs of companies. These are principals of schools, nurses and doctors in hospitals. These are actually all the people that I met and spoke to about the issue of loneliness when I was Surgeon General in the years that followed. And what they helped me realize was that loneliness is not only common, but it's also consequential. And what the research tells us is that people who struggle with loneliness have a higher risk of physical and mental challenges. So they have a greater risk of premature death, a greater risk of heart disease and dementia, a higher risk of depression and anxiety and sleep disturbances. And the list goes on. But the good news is that we can do something about loneliness, that there are in fact strategies that we can employ to address it. And part of what I did in the research around this subject and in the writing of this book was to spend time with people around the world who had not only studied loneliness, but in their own lives had worked on building different interventions to help address loneliness. And so I think that, I feel ultimately encouraged by what I have seen and heard, because as profoundly challenging as loneliness is, it turns out that small steps to connect with others, spending just 15 minutes a day with people we love, making sure the quality of time we have with others is high by eliminating distraction, namely our phones when we're talking to others, looking for ways to serve one another, recognizing that service is one of the most powerful antidotes to loneliness. These are simple but powerful strategies that can help us deepen our connection and improve our mental and physical health at a time when many people are in fact struggling with loneliness.
Thank you, Vivek. So how has being an immigrant impacted your journey and the way you looked at your career path, and also how you look at it in the future? So there's the immigrant aspect of you. There's the other aspect of having spent your life in service. How does this inform what you did, what you're going to do? Where is this going?
Well, my immigrant story is such an important part of who I am. My parents came to the United States ultimately from India. They made a few stops along the way. They spent some time in England. They spent some time in Canada, and eventually ended up here in the United States. And this is where I grew up. But it was their story was my story, and it was a key part of how I looked at the world. And one of the things that their story reminded me of is it reminded me to, number one, value and respect the sacrifices of the people who came before us. The United States in particular, whether you came here a few years ago or a few generations ago, we are by and large a nation of mostly immigrants. And as a result of that, if we look back at our stories and about the ancestors that came over, we often recognize that they came enduring great hardship. And my parents' story is very similar to that, and very similar to perhaps the stories of many others who are actually listening to this conference, and who also either came over during difficult times and endured great hardship, or whose families did. And so, I'm reminded each and every day when I talk to my mother and my father, which I do every day, that the sacrifices that they made to go from where they started. My mother, growing up in a modest family in Bangalore, my father growing up in a small village in South India, just a few hours outside of Bangalore, and growing up in the midst of really profound poverty. That where they started to where they ended up, which is traveling halfway across the world, arriving in this country with very little, but building ultimately a family, a place in the community, and a way to serve through the medical practice that they have now nurtured for nearly 40 years. That story, that journey is an extraordinary one. And no matter what I do in my life, I will never be able to get close to that delta, if you will, from where they started to where they ended up. But there's one other thing that I'm reminded of through the immigrant experience. And it's actually something that I learned directly from my parents. And there's a short story I'll share that really captures that. When I was 7 years old, my parents woke me up in the middle of the night and ushered me into the car and said, "Hey, hurry, we've got to go. Something just happened." And I remember being sleepy and bleary-eyed and confused, but just jumping into the back seat. My sister was there as well, and my parents started driving. And on the way, they explained to me that earlier that night, that their patient Gordon, who had been struggling with metastatic cancer, had passed away. And the reason that we were driving in the middle of the night was to go to the trailer park where Gordon had lived and where his wife, Ruth, still lived. And they were worried about her. They were worried she was going to be grieving alone. And so we were going there to check on her. Now, it's worth saying that this is not necessarily in my parents' job description. They weren't getting paid for this. They weren't billing for going to see Ruth. And if they had stayed home and taken in the news and then hung up the phone and gone back to sleep, nobody would have blamed them. But to them, there was something bigger at stake. And that was the bond that they had with Ruth and with Gordon. And it was a bond that they had built over years, and that told them that their job was not only to write prescriptions and make diagnoses, but it was to take care of the whole person. It was to take care of their families. It was to be a part of their community. And I will always remember that image that night of my mother in her sari, actually walking up the steps of Ruth's trailer, and the door opening, and Ruth coming out, with her long curly hair, with her glasses on, and with tears streaming down her face. Mm-hmm. And then the two of them embraced for what seemed like a long time, and there with the moonlight shining on them. And watching that from the car, I was reminded that these two people could not have come from more different backgrounds. Mm. Yet when I think of them, I realize now that in that moment they were family. Not the family that you're born into, but the kind of family you create for yourself. And so to me, that lesson from my parents is that there's something deeper than our traditions and experiences that bonds us to each other. There was our common humanity, our concern for one another, our desire to want to live from a place of love and compassion and kindness. And that, to me, is what America can be at its best. We're a nation where people come from very, very different backgrounds. Mm. But I think our challenge and our opportunity is to find that common humanity and to build a nation that is strong, because its foundation is essentially grounded in that human connection.
Thank you, Vivek. And this has been such a wonderful conversation for me, and also a conversation of hope as I see all the inequity that occurs in the United States and all over the world in healthcare. And I feel really, really good that you're going to bring to our health system this lens of empathy and kindness and equity and community that you talked about in this beautiful story. I could talk to you for a long time, but we're running out of time. And I want to thank you for this opportunity to speak with you. Thank you on behalf of the IIT Global Conference and all of us in the United States who are looking forward to your leadership in the COVID-19 pandemic to help us all be safer, our families safer. Thank you.
Well, thank you, Sanjeev. I so appreciate the chance to be with you. And I just want to say a last word to the IIT community itself, because I grew up with many family friends who are IIT graduates, and I've watched with great pride as IIT graduates have made their mark, not just in the United States, but really around the world. Have helped usher in new technology, have helped birth and grow companies that have literally changed how we live our lives. And that's an immense source of pride for me, and I know many who are connected to the community. But I think that this moment in particular is one where we need the IIT community, where we need entrepreneurs, where we need people who understand technology. And it's not just because we have needs that technology can help meet, but we need conscientious entrepreneurs who also understand that technology has upsides and downsides. And to be able to truly get the most out of technology, we have to understand and amplify that upside, but also recognize and manage that downside. When I think about the world of social media, for example, I think about a world that has tremendous potential upside, but one where we have been late to recognize and manage the potential downside of it. If we use technology well in the months and the years ahead, I think we will transform a lot about the world, but particularly in health. And I think we're going to bring care closer to homes and neighborhoods. I think we're going to use data to better target our interventions to those who need them, and thereby use like this amazing, extraordinary expanse of information that we're getting from genetic data, microbiome data, neighborhood and behavioral level data, and actually use those to figure out how best to tailor our therapies and our sort of community level interventions. And if we use technology right, I think we'll also be able to better identify the signs of illness before it presents in fully blown fashion and harms lives and destroys families. This is just a smattering of what technology can do for us. It's just a taste of the opportunities that await. But to harness that power requires people who understand technology, entrepreneurs who are willing to step up and take a chance on new ideas. And it also requires people who can bring a set of human values, as I think of them, to guide our use of technology, to guide how we build businesses in the world. As impressive as our advances have been in science, as well as in technology, it is ultimately our values that make us strong as a country and as a world. And the question I think of more often now than ever before is, as we design policy, as we build new initiatives, as we educate our kids, what values are guiding them? Values that I believe should be teaching them about what we mean to each other, about what their duty is to promoting and supporting the common good. It teaches all of us and reminds all of us about the power of love, compassion, and kindness, and how these are not sources of weakness, but they are in fact our greatest source of strength and power if deployed properly. And so my hope for all of you and for all of us is that we will go back to the world anchored in our values, confident in the power of our connections with each other, and use those values to build the kind of world that all of us and that our children deserve.
Thank you. Thank you. Thank you, Vivek, very much. Vivek, as we discussed after the formal chat, that I've known you since you were 5 years old, for a long, long time. And your value for the family can be exhibited in the way you have stayed at your parents' house since you went there in March and then COVID started. Now in your house, there are 4 generations of Murthis living. Vivek's grandmother and his parents and his own children, they live in that house. Can you believe that? He's been like a little son to me, obviously, and but phenomenal. At this time, I would like to bring in Dr. Sanjeev Arora, who conducted the fireside chat, and for the next few minutes, he will explain what he got out of that fireside chat. And Sanjeev, please.
Well, thank you, Ron. It's such an honor to be at this conference. Living in the United States for the last 40 years, I've sort of really always admired the people from IIT and how you have really transformed the reputation of the India in the United States through your leadership, through everything you do. So thank you for that. I think your work has helped us all. So let me just say a few things that I've learned from Vivek Murthy, but also a few of my own thoughts about what is happening. I know you're all thinking about COVID-19, so I'll go there first. My biggest concern right now, as I mentioned in my questions, was that, I actually personally, being a physician, will get my vaccine in about 2.5 weeks from now, right? We are the first wave in the US. We're going to get vaccinated. And as I mentioned, now the more recent information is 5-6 months. Of course, everybody will get the vaccine in the United States, and Western Europe has reserved all the doses. So when I look at India, where I'm told that half of our membership today is here from India, the challenge that I'm seeing is that we've got to vaccinate 1 billion people there. Now, as opposed to the United States, some of you who live here, you're used to getting your annual flu shot. But in India, they don't get flu shots. They don't have a massive vaccine workforce for adult vaccination. If we take our existing vaccination workforce, put it into adults, then the children will not, and the pregnant women won't get vaccinated. So what we have to do is we really have to do some massive work in India right now to scale up a vaccine delivery workforce. I think the second, if we are going to really prevent the spread of this disease in India, continuous impact on the economy, continuous impact on your lives. Just a call before this, I was with somebody in India, and they've been at home and working from home for the last 7-8 months. And I'm sure some of you are already doing that. So I think with IIT and all the intellectual and economic horsepower that you have in India, we need to work on this because I know there's a lot of talk in India about the economy, but the issue is there's no economy unless we get this under control. And so I'm urging you all to take on this challenge. Another challenge that I'm seeing for people, some of you who are living in India, is that the vaccine that is going to be manufactured in India by the Serum Institute is only 70% effective. Okay. Now, you know, if you're making an investment and I give you a 70% chance, you might be happy with that. But the problem is in your own health, that's just not good enough. Okay. That vaccine, you need the more modern vaccines that are 95% effective for, I'm seeing some of you, nodding. Some of you need to really have that vaccine so you have the confidence in going out. How many of you will go out into India and do your regular work knowing that you have parents, and Ron's example of 4 generations at home with a 70% efficacy, coming back and possibly taking it to your families? So I think a concerted effort has to be made by India to rapidly scale up the new vaccines. That means, what does that mean? Partnerships with Pfizer, partnerships with Moderna, and that type of interaction is required for us to really. So what have I been doing in this area? I run a project. Our mission is to democratize knowledge. It's a not-for-profit all over the world to help 1 billion people by 2025. And the project is based on the idea that, I was a hepatitis C doctor, and in New Mexico, where I lived, there were 28,000 patients. I could only treat 1,500. I'd only treated 1,500. There was an 8-month wait to see me. So I said, okay, I'm going to start a new model, which we call ECHO, where I would make sure that all 28,000 got treated. And the idea of that is what we call force multiplication. How do we exponentially improve the capacity to develop best practice care? And I took primary care doctors. I'm a specialist in gastroenterology around the state of New Mexico. And I said, why don't you join me? I'll show you a picture of India, ECHO in India. I said, why don't you join me in this interactive video network where you present patients to me and you'll become experts at this, okay? And I did this for hepatitis C, and then I did it for 70 other disease areas in the United States, and we brought it to India. But here's the real issue is that now we have 1,100 networks of this kind in 165 countries. And in India, what we have done, I want to just show you we have trained about 326,000 learners on COVID-19, community health workers, doctors, And we've been seeing this exponential growth curve of ECHO attendance. We had 237,000 mentees in 2019 and 750,000 till September 30th, and now 950. The reason I'm saying this is we are partnering with the government of India to build the capacity. We need to train a couple of million vaccinators, people who are experts in, because as you know that in the US, for example, only 60% of people are willing to take the vaccine. In India, we will also have vaccine hesitancy. So we need to train a community health worker workforce, ASHA workers, to convince people to take it. We need to train vaccinators and on the idea of how to give the vaccine. There is storage, logistics, and then we have to train the workforce on how to manage side effects. And I see this as a major challenge for all of you. We are using currently in ECHO in India, we have a massive number of networks operating, 150 networks, partnerships with state governments. And I hope some of you who work for the government will engage with us first in the area of healthcare and then with the area of education to improve education in rural India to improve the lot of people there. I think the other thing I learned from Vivek Murthy was this idea of joy through service. And Mahatma Gandhi said this very nicely. He said, the only way to find yourself is to lose yourself in the service of others. And I hope many of you who are entrepreneurs will take some time and energy to use your technological prowess to help India. And we certainly want to bring our services, our networks. And I want to thank Eric Wan, who is giving us basically he's a friend of mine and he's given us the ability to give Zoom free to all the people in India who want to use it for the purpose of social good. And we have currently already set up about 1,000 separate Zoom accounts with state governments, the central government of India, etc., and now in the field of education. And I'll stop here. Ron, thank you for this opportunity to speak to the audience. And if there's any question you have, or if you have time, I'm happy to take more, but I'm so honored to have this chance to talk to all of you.
Thank you. Thank you, Sanjeev. It's so wonderful of you to have interviewed Dr. Murthy and then giving your own thoughts. And thank you also for your good words on Zoom. They're one of our big sponsors, and they will be speaking a little bit later today. And thank you again, Dr. Arora, and obviously thank you, Dr. Murthy.